Imagine spending your entire shift caring for patients, then spending 3 more hours after that writing your paperwork, not because your patients need it, but because an insurance company decided to say no. Now imagine doing that every single day, watching your colleagues do it until one by one they burn out, they quit, and the hospital starts cutting services. That is not a hypothetical. That is what is happening right now across America. And today's guest lived it from the inside as a nurse, as an operator, and now as the founder of a company fighting back. Today, we are talking about a problem that touches every single person who has ever had a health insurance, that has been a patient, worked in healthcare, or run a business that offers healthcare benefits. Insurance denials. Most people think of it as an inconvenience, a bureaucratic headache, something that you deal with and you move on. But what if I told you that insurance denials are quietly contributing to a nurse's burnout, hospital closures, and patients who skip care, not because they don't need it, but because the system wore them down? Now, today, my guest is Gretchen Heinen. She is a registered nurse, a healthcare of technology founder, and the CEO of Authsnap, an AI-powered platform that helps hospitals and medical practices fight back against wrongful insurance denials and recover revenue that should have never been lost in the first place. Gretchen spent over a decade on front lines of this problem in trauma, ICU, emergency medicine, and revenue cycle operations before deciding to build the solution herself. Gretchen, welcome to the show. I am so excited to have you on. This is a problem that we find so common in our society, and I'm so glad that you're taking the time to spend some time with us to let us know a little bit more about it and what we can do about it.
Oh, thank you, Stacey. It's a pleasure to be here, and it's exciting to see your show and all the great work that you're doing.
Well, thank you so much. Let's start with what most people don't understand about insurance denials. When most people hear insurance denial, they think about a bill, a phone call, maybe something that's frustrating. What does a denial actually look like from the inside of a hospital?
Yeah, that's a good question. I think the thing that a lot of people don't really realize is, we have a law called EMTALA, which means we have to provide care for patients whether they have insurance or not when they walk into the emergency room. So if we're specifically talking about a hospital, they don't really have a choice as to whether or not to care for the patients, regardless of that patient's ability to pay. They have to stabilize the patient according to the law and they have to treat them. So what happens a lot of times in the hospital setting is you have all these variety of patients, and then you have all these different types of insurance. Some patients who have insurance, some who don't, some who are partially insured. And then you have different levels of what we call acuity, or is how sick the patient is. And so all of that turns into a fine dance with the insurance company as to whether or not the care that the patient's actually getting is going to be paid for. I think most people see the opposite side of this. They see a bill from the hospital and it charges them $52 for a Tylenol, or they see these extravagant costs on their hospital bill. And so a lot of times people think that the hospital is really the problem. But if you really peel the onion layer, we have a giant mess when it comes to how our healthcare is actually paid. And it's probably a deeper conversation than we want to go. But the bottom line is that hospitals actually operate on less than a 2% profit margin if they're healthy. Most hospitals are at a negative 10% profit margin, meaning they are losing 10% every year and rely on foundations and donations. And I think people don't see that because they see big buildings being built. They see
Yep.
Tylenols costing $50,
Yep.
and they think, oh, these places are killing it, but they're actually really, really struggling. And it's because a lot of times the care they've delivered actually isn't getting paid for.
Right. No, that's true. You see it from both sides, actually. The patient sees, she gets their bill or he gets their bill and they start looking at all the costs for everything. And all of a sudden, like you said, $50 for a Tylenol and, they're getting, for a seltzer, you're getting charged X amount of dollars, and they're like, these people are just like ripping me off. And then you look at it from the medical perspective, and they're not getting paid for a lot of these things. Yeah, a lot of denials come in that a lot of our society has no clue and is oblivious to. So What is the nurse at the bedside experiencing that the patient at home never sees?
Well, there's certain roles in the hospital that never deal with any side of this. And, I think for the most part, the nurse at the bedside, the one starting the IV on the patient, administering medication, that person is pretty immune to this problem. But the type of nursing that I did, which was still at the bedside, was a type of nursing called utilization management. And it's where a clinical nurse gets involved in the patient's care to make sure that the hospital is going to get paid for the services we deliver. So we're looking at how long they're staying, how sick they are, what their insurance is, what their insurance has to say about them staying in that bed for the day. A lot of times we have to get approval every single day for each patient. So that means making sure that the insurance companies are okay with the patient staying or have approved for that day on every patient on every floor of the entire hospital. So there's a whole side of nursing that goes on that just makes sure that the hospital can get paid. And these types of nurses also exist in the clinic, right? So they might be kind of a care manager in the clinic where they're coordinating with the patient's insurance. So that's the type of nursing that I did. And it's what inspired me to really go after this problem because I was seeing patients die and get delayed care over sheets of paper that didn't
Yeah.
have boxes checked on them. And frankly, I didn't go to nursing school to fight insurance companies, but I went to nursing school to help care for people. And if you can't pay for the care, you can't give the care. So it doesn't matter how well we are doing in this country as far as technology and how skilled our doctors are. If there isn't someone to help pay for that care, we can't deliver it. So it really is the root of the healthcare problem that we have.
It's so true. So true. Now let's put a number on this because I think people will be shocked. So in 2025 alone, hospitals spent nearly 18 billion on just overturning claim denials. And when you add that up, all that administrative costs of collecting payments from insurers, that the number reaches actually 43 billion in American Hospital Association. That's what they mentioned. Now, the average physician's practice now completes 39 prior authorization requests per physician per week. Now, and more than that, a quarter of the physicians say that prior authorization has led to a serious adverse event for a patient in their care. And that was quoted by the American Medical Association. So, Gretchen, when you look at those numbers from where you sit as a nurse and now as a CEO, what do you feel?
Oh man. Well, there's even more numbers that if I can add to some of those statistics, those are
Yeah.
all amazing statistics. So in the United States, there is about $262 billion worth of claims that don't get paid every year or that are denied. Okay. So if you think about that number, there's 370 million Americans, the amount of claims that aren't getting paid. I mean, it really is touching almost every single person in this country. And there was like a study done on physicians, and the average physician is spending 13 and a half hours a week just on this type of work. Okay. So not seeing patients, just on the documentation of the insurance side. So we're not even talking the charting that happens. And as having a physician husband, there's this thing called pajama time where physicians, they actually study pajama time, and it's the amount of work the physicians are doing in their pajamas at home after their shift is over. So this is taking away from their family time, their personal time, their health. They're already working a really long week. So
Yeah.
adding this in, is a really important thing to measure. So there's hospitals who measure their staff's well-being based on when they're logging in, seeing physicians logging in 10, 11, 12, 1 o'clock in the morning just to try to get this administrative work done. Like, it's costing our patients. It's a problem for our patients, of course, because they can't get the care they need, but it's also causing physician burnout and nursing burnout. And then if the people caring for them are burnt out, and suicide rates are rising, and we have a huge mental health problem in our physician force because it's just impossible for a human to carry this kind of load where they have to care for the people and they have to worry about how it's going to get paid for. So, I mean, it's like a comprehensive problem all across the board. For me, it's, sad is one word, but probably infuriating is another word that I would use, because healthcare workers work tremendously hard for our patients to try to make sure we're able to deliver the care. and we care about our patients, right? But
Yeah.
our hands get tied when it comes to this, and we can't, if there isn't someone to step up and say, okay, I'm going to fix this piece, even though it's not the sexiest part of healthcare,
Yeah.
you know, but we need to fix this piece so that people can deliver care, that they can have well-being in their job, that hospitals and rural communities can stay open, physicians can continue to own their own practices without being swallowed up, and patients are able to get what they need. I mean, we really have to solve this problem. So that to me is what is my passion.
I love that. Now, where is all of that money and time actually coming from?
Well, a couple of things. So everything has to have rules in life, right? So we have rules for driving on the road. We have rules for when you have to start and stop school and what constitutes an A on a test, right? We live in a rule-based society. So insurance is no different. They have to create rules too. And so a lot of times, take aside anything that you feel is nefarious about the insurance companies, like put that aside because there are people who have those opinions too. But just from a strictly logical side, if you have a policy, there's going to be rules inside the insurance policy about what's covered and what's not covered. So a lot of times what happens with these denials is the patient will fall outside of the rules, but it's still the right decision. So the way I describe this is that every day in doctors, and I show a picture when I tell this story of like different doctors, like one's performing surgery and one is like sitting in front of a computer and one is like performing a procedure. And I talk about how all of those people are making split-second decisions that are
Yeah.
right for the patient in that moment.
Right.
And those decisions are not ones that you can like leave the room and go consult somebody or ask for permission. Like you have like seconds to make this decision, right? So they're making these decisions for the patients. But then when we go to bill the claim, those decisions don't fit neatly inside of the boxes of the policy. An
Right.
example I can give is I had a patient once who had chemo and there was 3 drugs in the chemo. Well, the societal guidelines for this type of cancer said you need to give all 3 drugs for this chemo to be effective. And the doctor ordered 2 of the 3 drugs
Mm,
because the patient was too sick to get the 3rd drug.
right.
So if you think about that from a logical standpoint, like that makes sense, right? Like let's give him 2/3 of the treatment because that's better than 0 treatment.
Exactly.
And the insurance company doesn't see it that way. They saw it as if you're not going to follow the rule and do all 3, then you get none of them. You get
Yeah.
nothing. And so so the whole claim gets denied. So the work that we're doing is really working to speed up that communication between the doctors and hospitals and clinics and the insurance company to say, time out, let's do 2 of the 3 drugs and let's justify why that should be the case. Right
Exactly.
now, it takes a nurse a lot of time to write that letter and make that case, but we created
Yeah.
software that can do it in 5 minutes because it's using some AI and some logic that we built into it from our own brains. And that's really sort of the goal of what we're trying to do is to break apart these boxes and
Yeah.
make sure that patients get what they need, even when they fall outside of the box.
Right. Oh, that's wonderful. That's amazing. Completely amazing. Now, here's where I want to slow down because this is not just a business story. A 2025 survey found that nearly 3 out of 4 nurses, 74%, say that they feel emotionally exhausted multiple times a week. And that was from the nurse.org organization. And then that 89% of physicians say prior authorization contributes to their burnout. And that was by AJMC. So, Gretchen, in your experience, how much of that burnout is directly tied to denial and the appeals process?
Oh gosh. Well, I think depending on where you work in the medical field, it will be different, right? Because some of the people are never going to see the denial, like the ER nurses. They're going to provide the care whether the denial happens or not, right?
Right.
But I think what happens is the downstream effect of the financial pressure of the hospital is felt by those ER nurses because that equals longer shifts, higher patient staff ratios. I remember going into my supervisor's office for my annual review and getting like a 10-cent an hour raise.
Yeah.
And you're like, had just witnessed somebody, there was like CPR happening 5 minutes before that meeting,
Right.
and I'm thinking to myself like, wow, this is only worth 10 cents an hour raise. And so there is a disproportionate amount, like what I'll say is the financial pressure that's caused by the denied claims creates a ripple effect all the way down to wherever you're working in the hospital because it's going to either affect your raise, your time off, your bill, your how many patients you have to care for. And then if you are the person responsible for that, which many times physicians are held accountable for this stuff of calling the insurance companies. And, the nurses, when I worked that role, I mean, I couldn't leave for the day until I got all these patients that were, discharge ready out of the hospital. So I had to find somewhere for them to go, or I
Right.
couldn't go home essentially, or I, that would not fare well with my supervisor if I had gone home and all these patients are
Right.
still sitting here. That really is a very stressful job. So depending on even if you're just impacted by it anecdotally because you're impacted by the financial strain of the hospital, or whether you are the person actually directly responsible for it, which many times it is the physician caring for the patient, they are the ones that have to call the insurance company and be on the phone with another doctor from the insurance company. I mean, I felt that every day of my career, and there
Yeah.
were many times that I would cry on the way home from the hospital. I know I had peers that were the same way. And I do think there's a percentage of people that just become jaded. So there's the ones that stay compassionate and become overwhelmed and burn out. And then there's the ones that get jaded, because they're just so frustrated. That's
Yeah.
not why they went into healthcare. And
Exactly.
honestly, I it's sad when that happens because they went to a lot of school, but I honestly don't blame them for being jaded. It's
Yeah.
like you can only handle so much in your job
100%.
before you explode. So
Yeah.
I have a lot of compassion for the ones who are at that point because it's not because they wanted to get there.
Right. No, it's so true. Now, what does it do to a clinician, someone who went to healthcare to help people when they are spending hours, fighting paperwork instead of treating patients?
Yeah, well, from my experience, it makes them want to leave the field of medicine altogether. So I know a couple of doctors who I worked with who then became real estate investors. And I mean, they switched careers completely. Like they didn't even care that they had spent hundreds of thousands of dollars on their medical degree and, a decade getting it because they were so frustrated by the economics and the politics of it that they could no longer even be in the industry. I think some of them feel energized by it and then go into management. So my co-founder is a physician. He felt so, inspired to try to help solve the problem. So he now cares for patients and works on the administrative side. So he like took on a second job to do it, right? Like
Yeah.
that's like somebody really passionate about solving it. But I think overall what it's doing is it's really eroding our physicians because they went into this to care for patients, not fight insurance companies. And when we put this burden on them, it's taking away from their zone of genius and it's putting them in a situation where burnout is very real possibility. And then we don't have enough physicians to care for the patients. We literally don't have enough doctors right now in our country. And it's
Yeah.
not going to get better if this field is so problematic for them with paperwork and they're so burdened by paperwork.
100%. 100%. And what happens to the hospital when those clinicians leave?
Well, I mean, that hurts the whole community, right? Because they can't fill the positions. And if you think about it, how they are billed is on a delivery of service that those physicians are providing. So then they can't bill the insurance company. So it's a loss of revenue. It's a loss of an ability to care for the community. It's a loss of their quality scores, which matter for Medicare, which means a loss of reimbursement. So it's a huge problem if physicians leave the hospital system or even healthcare in general.
Yeah. Yeah. And I see that happening all the time. I was talking briefly with you, when I just, watching, doctors and nurses just leave because they just, either it was monetarily or the stress level was just way too much. And a lot of times it was the stress level. And you could just see it on their body language and their facial expressions. And it was just getting too much for them. Now, if you're running a healthcare organization, a medical practice, or you work in this industry, this conversation is for you. And if you ever had a claim denied, a bill that you should not have owed, or treatment delayed by insurance, this is also for you. Follow this podcast. These are conversations that connect with what is happening in the business directly to what is happening in healthcare and why it matters to all of us. Now, let's trace this all the way through because I think people do not connect the dots. A hospital starts losing revenue from denials, then it makes the cuts, then it closes a service line, then sometimes it closes entirely. Like, A 2025 KFF poll, they found that 73% of Americans believe that delays and denials of care by insurance companies are a major problem. And that's a view shared across party lines, the KFF and Gretchen. So, who gets hurt the most when a hospital closes or cuts services because of financial pressures and from denials?
The community, by far the community. Specifically rural communities are the most impacted by this because if a rural hospital closes, meaning a hospital that's in a small town that's hundreds of miles away from a big city, when those hospitals and clinics close, if you think about it, if someone becomes pregnant in that community, now they have to travel 2 to 4 hours to be able to deliver a baby. Well, that's a terrible situation for somebody who's in labor, right?
Oh, yeah.
And if you have a break, right? A lot of times these healthcare facilities, they're usually called federally qualified healthcare sites. So they have federal funding that sort of help them stay afloat. But, if something really bad happens or a patient has too high of an acuity or they're really sick, they stabilize them there and then they transfer them out. So if they can't even stabilize people in the community, people cannot access their medications. They can't find early detection of strokes and early treatment of heart attacks. Those things are literal detrimental to the communities. So we cannot allow our hospitals to close. I mean, that is one of our biggest missions is to keep hospitals and clinics open all across the United States by helping them with this piece, because we know that when you fix denials, you can actually change your net revenue into the positive by just looking at that one pool of money that's being lost. Not
Right.
even talking about changing your operational workflows or doing any kind of like Kaizen or, process improvement. Literally digging the money out of the trash can help
Yeah.
get your hospital in the black.
100%. Now, is this problem worse in the rural area or underserved in communities?
It's everywhere. It's just at different magnitudes. So in the rural communities, it's felt harder because if you lose the healthcare there by the hospital closing, that is felt harder. But the problem is not solved better by a bigger system. I mean, we've been in partnerships with some of the biggest hospital systems in the United States, like names you would recognize if I said them, and they have the same problem almost at the same percentage. So about 20% of all claims get denied. Now, a really, really good hospital is maybe getting that number down to 11%. I've seen some clinics where they're hitting home runs and they've reduced a lot of their denials, but usually that's a really unusual situation. In most cases, most hospitals and clinics are losing up to 15 to 20% of their revenue to denials. Yeah,
That's
imagine
amazing.
like I always tell people, imagine your household budget getting cut by 20% tomorrow. Right? Because it's hard to imagine this problem until you like internalize it to your own money. Like if
Yeah,
20% of your paycheck disappeared like that tomorrow, how would
right.
that impact you? Okay, now imagine that's the
Exactly.
business of keeping people alive.
Yeah, that's insanity. Oh my gosh. Now, let's talk about the moment you decided to stop surviving, and this moment problem, and you started solving it. You were a nurse, you moved into utilization management, and then revenue cycle operations. You saw this from every angle. What was the moment you said, I have to build something?
Yeah, gosh. Well, I remember it distinctly actually because I sat my husband down and I was like, well, first I quit my job. I quit my job because I was at the time I was working in a piece of healthcare I didn't quite agree with, and I quit my job because I couldn't do what I was doing anymore. And so there was a period of time where I was like trying to figure out what was going to be my next. Was I going to go
Yeah.
back into the hospital? Was I going to go back to utilization management? What did I want to do? And I really started seeing a bunch of women around me doing really amazing things in business. I had been a part of some masterminds, and I know you do coaching. So this is like, right up the alley of what you do, I really sort of woke up to like, what would it look like if I just 10x'd my career and myself? And
Yeah.
I went for the biggest thing possible. And the thing I knew the most about was healthcare finance. And you don't just like go from a nurse to like changing healthcare finance overnight, right? Especially by yourself. And so I remember sitting my husband down, and at the time I was an early user of ChatGPT. So this is in 2023. And, so ChatGPT was kind of gaining some popularity, but I had been using it for about a year since it came
Yeah.
out. So ChatGPT was like 2022, right? Yeah, it sounds like you were too. And so I was like kind of seeing where technology was going. And I was like
Yeah.
looking at how I did my job. And I was just thinking, like, how could we merge these two worlds?
Right.
And of course, I don't know anything about engineering. So I called a couple of lawyers and engineer friends and I'm like, hey, I have this idea. Like, is this even possible engineering wise? Like what
Yeah.
I'm trying to do. And they're like, oh, yeah, that's totally possible. So I was like, okay, cool. So I sat my husband down and I'm like, I have this idea. It could go horribly wrong. We'll probably lose a lot of money and if it goes wrong, or it's going to go amazing and it's going to change our family forever
Yeah.
and it's going to change a lot of people's lives. You say no and you don't want me to go after this dream, I won't do it because like I
Right.
need your support. I need your buy-in because like we're literally going to have to invest our personal money into it. I'm probably not going to pull a salary for a little bit while I'm building it. And, I'm going to have to get venture capital money. Like we're talking the whole nine yards. And so
Yeah.
he's like, okay, let me think. He knows me and how I think. And he's like, let me just think about it for a few days. And so he comes back and he's like, you know what? Just do it. Like, what's the worst that can happen? I'm
Yeah.
like, well, really, the worst that can happen is I have to go back and work as a nurse. And that's what I'm already doing. So, like,
Right.
I'm already living the worst case scenario of this outcome. So, like, why not just go for it? Right. Like, whenever people are like, I don't know if I should do it, I'm like, okay, well, what's the worst that can happen? And then they say it out loud. And I'm like, is that really that bad? So, we just went for it. And then from there on, it was just getting the right people at the table. And I'm so fortunate to have an amazing team of people who are, former VPs of really big companies and
Yeah.
engineers and nurses and salespeople. And so I really, sure, I had the initial idea, but within a month, I had people around me that were there from the beginning that helped us to build it. So we got really fortunate there.
I love that. That's amazing. That is totally amazing. Now, what did the landscape look like when you started? Was anyone trying to solve this?
Yeah, there was a lot of people trying to solve it actually. And there are a lot of, especially now, there's lots of things popping up out there that are, claiming to use AI to solve this problem. It's actually one of the most popular things that VCs are investing in right now is the healthcare finance delivery models.
Right.
But I will say the thing that sets us apart of the people building it is that we are clinicians first. We're not engineers first. We're doctors and nurses first. I mean, the first person I called was my physician, my favorite doctor I ever worked for. And I was like, hey, what are you doing? Are you working for somewhere where you can like do a side gig?
Yeah.
And he's like, yeah, I'm a free agent. He was working as a locum at the time somewhere. So he's like, yeah, I could do that. And I was like, okay, cool, let's go. And we've built this to think like a clinician. And a lot of people build software to think like an engineer. And so they
Right.
come at it from like a math problem, but this is like a clinical problem.
Yeah.
So, I mean, we were so fortunate to have built this at the exact right time that the market was asking for it. And in fact, we were a couple of years ahead. So it gave us like it was like right place at the right time. So our company is in a really special spot where we are small enough to be nimble, but we're big enough that we can handle large scale. And
Right.
some of the bigger companies that have been in this space for a long time, for them to adopt this newer agentic AI technology, it's really difficult for them because they have to try to integrate new technology to like old systems. And it's actually
Yeah.
hard for any hospital to, which is why we built it on a cloud-based solution instead of an EMR solution because we wanted to be able
Right.
to move quickly. But yeah, so it's cool. Like I invite the competitors because I'm like, there's this problem is big enough. You're going to need all of us working on it.
Oh, yeah, for sure. 100%. Now, let's make this practical for the business people listening. AuthSnap is a clinical AI to automatically appeal denied claims and recover up to 75% of lost medical revenue. And it can reduce the time to draft an appeal from hours to minutes. So, walk us through what actually happens. Like a claim gets denied, then what?
Yeah. So when a claim gets denied, our partners that are our customers, we literally either share a list of what the denied claims are that they want us to work on, or we have access to their system so we can go in and see what's being denied. But essentially, we just need an alert that there's been a denied claim. From there, we do everything. We go in, we grab what we need, we run it through our system. It spits out the appeal letter. We hand it back to the doctor and they submit it. So the process really takes about 5 minutes per claim. And it allows that physician to be freed up, to not have to worry about that. They don't have to have their IT team build an API for us. I mean, we literally are completely cloud-based, and we're built on Microsoft's Azure, secure HIPAA, SOC 2, high trust compliant, so it's all secure.
Right.
And so everything is just a smooth transition. Files come in, appeal letters come out. Files come in, appeal letters come out. And then we have a nurse or a doctor that checks each one to make sure that it's clinically accurate before it heads out the door.
I love that. I love that. Now, what does Authsnap do that a billing team cannot do manually?
Yeah, well, a billing team is not going to have enough time to handle all of these claims that are being denied, because you have to dig, right? I mean, I was reading 100 pages of clinical on every patient that I was working when I was in the hospitals. I'd have to read the H&P, I'd have to read the specialty notes, I'd have to dig around for what medications the patient were on. Well, now with technology, it can do all that in minutes, right? And
Yeah.
so it is finding all the relevant information that's needed to overturn these claims. And billing teams now can use their time to actually bill, to actually collect the money, like, to do
Yeah.
the things. So we always talk about how this technology, like, it's not replacing people, it's giving them leverage, right?
Yeah.
So now these teams don't have to do all this tedious work. They can do other things. Like, you can free those nurses up to do other things now.
Right. Oh, wow. That's amazing. Now, what does human in the loop mean in this context, and why
Yeah.
does that matter in healthcare specifically?
Yes, it matters so much. So human in the loop essentially means you're not letting a machine go rogue without somebody checking it. It's like a checks and balances. So for us, what that means is our software is trained by us as clinicians. We don't rely on ChatGPT to decide what should be in these letters. We have
Right.
told the software, hey, if you get a sepsis case, you better make sure you include the SOFA score. You better make sure the patient temperature is in there, the medications, the timeline, down to what was temperature on day one? What was temperature on day
Exactly.
two? How did it trend? You know, what was their fluid like? What do their kidneys look like, right? So we're
Yeah.
telling the software exactly how to think. So that is really human in the loop, where there's a lot of people building technology in this space right now. Like I said, they're like thinking about it from an engineering standpoint. So they're like, "Oh,
Yeah.
how can I like write a good prompt for Claude?" It's like, "Well, I'm sorry, but Claude doesn't know Betty at United Health Group and how she likes to get a denied claim appeal letter, right? Like,
Right.
if Betty sees a letter with a bunch of M dashes and
Mhm.
overly positive ChatGPT language, your appeal letter is going straight into the trash.
Exactly.
Like, you have to have humans putting their input into this, because on the other side of the insurance company is a human reading this letter. And it's a
Exactly.
human reading the patient's story and your plea for them to change their mind that this should get paid.
Yes.
So, to us, human in the loop is like a non-negotiable. Like, there has to be human element into this
Right.
process.
Oh, for sure. Now, for the executives and the operators listening, let's talk dollars. When denials that were appealed were actually reviewed, like 81.7 were fully or partially overturned. And that was from the American Medical Association. And that means that the majority of denials get challenged or they get reversed. So, why are so many hospitals and practices not challenging more of them?
That is a really good question. It's actually why we built this technology. It's because there's not enough capacity. When I was doing this work, I had 4 or 5 roles that I was responsible for that day. One of being making sure that the insurance company approved the claims. Another being making sure the patient was getting the right care. Another being that the patient had a good care trajectory. Are they progressing on day 2 from day 1? And then another one of my jobs is I had to make sure I knew where this patient was going after the hospital. Are they going to a skilled nursing facility? Are they going home with home care? Are they going to an LTAC? And then my last job was to make sure that the patient was actually going to follow up with what they needed after they got home. Did they have a follow-up appointment? Did they have a ride to get their meds picked up? Could they afford their medication? Is there somebody there who's going to make sure they don't fall? So if you think about, I was doing 4 or 5 jobs in one, and the insurance piece is probably the one that's going to fall off if any of them are going to fall off. That's the
Yeah.
reason that most hospitals don't appeal their claims. It's because they can't get to them.
Right. That's a really good point. Now, what is the cost of doing nothing?
Oh man, I mean, literally, it's closing, your hospital will close. And what ends up happening most of the time is service lines will get cut, right? Like you mentioned, or the hospital will close. They'll lay off nurses or doctors. I mean, and sadly, the CFOs who are managing the P&Ls for this, who are the ones who are actually looking at the numbers, right? The CFOs
Yeah.
of the hospitals. So I have personally talked to probably 200 to 300 CFOs in the last year. Okay. So we went on a tour all across the country and met with CFOs all over the country. And I'm talking from Montana to Texas to New York to Arizona and
Yeah.
Michigan. I mean, I've been everywhere. I could tell you all about their families and their lives. And what ends up happening with these CFOs is they have this aging AR on their balance sheet, and a lot of it's denials. The problem is aging AR looks really bad on an audit, right? And so
Right.
what they do is they just write it off, meaning they're going to like take a tax credit for it, or they sell it to a debt collector to collect on the patient's debt. So usually it's like 10 cents on the dollar that they'll sell it for. And it's not because they're trying to do that. They literally don't have another solution. And so
Yeah.
what people don't realize is that a lot of times this money, because there's nobody to work these denied claims, they're being forced to just like let it go.
Yeah.
But that is what's causing all of the closures and, buying up of these clinics and, consolidations that happen. It's because they don't have enough people to work those denials.
Right. No, that's so true. Now, what does a practice or a health system typically recover once they start fighting back?
Oh, yeah, you can get like 75 to 80% of it back of the
Really?
denied claims. Yes. Yeah, the industry average is about 60, but we have found that if you do it right, you can get 75 to 80% of it back. So, I mean, literally most of it you can get back if you just, put someone or someone like Authsnap, put them on it. They'll start getting it back.
Oh, that's amazing. That's amazing. Now, I want to open this up for a second. We have business owners and leaders listening to this show. So some of them are not in healthcare, but all of them either offer health benefits, interact with healthcare system, or have employees, who do. So what should business leaders outside of healthcare understand about how the denial system affects their people?
Yeah, this is actually a really good question. And one of the things that we're trying to educate on right now is employers who offer benefits to their employees, because this really impacts your employees. So we sometimes come in and offer webinars to the employers. We've even had situations where we've partnered with employers to offer services for their employees where as a group we can work on denials. So we've done some things in that direction. What they really need to understand is they need to have a good contract in place. I mean, that is literally the most important thing, is that they need to realize that the contracts that they're putting in place are going to affect their employees. And so, I have a couple contract negotiators. We don't do contract negotiation at Authsnap, but we partner a lot with them because on the other side of a denied claim is a contract and a policy that is, being challenged. And so
Yeah,
we want to make sure that those are negotiated correctly. So I always just, encourage people to really get good benefits managers, get people who actually care about the benefits.
right.
There's something that people might not realize is that the people who provide benefits, so benefit brokers, they're actually make more money if the premiums are higher.
Mhm.
Naturally. So it's not really in a benefit broker's best interest to create a policy that is the lowest cost for the employee.
Right.
And, this is just the nature of the business. And so you're going to have a wide variety of people in that industry who are really in it because they care about the employees, they care
Yeah,
about putting together good benefits. And then you're going to have people in the industry who just want to make the most amount of money. This is just a
exactly.
reality. Okay. And I'm not saying that the whole industry is tainted. I'm just saying when you have a payment model where you make more if the people pay more,
Yeah,
that is the natural consequence of that payment model. So
yeah.
there are companies out there that will help you to negotiate those contracts and help you to make sure those contracts are in place.
Wow. Now, is there anything employers can do to advocate for their employees or, when coverage gets denied?
But they can partner with us and we can help them. Yeah. I mean, there's educate. It really starts with education because at the real root of it, We want to work for the provider that's getting that denial, that's impacting that patient. Because when we work for the provider versus the employer, we can help all of the patients, right? And so employer groups, when they have that, if that becomes a pattern, I'd love to talk to them, because then I can go into the health systems that are in that area and we can
Yeah.
start to work on those health systems to start changing that for them, which helps the whole community, not just their
Yeah,
employees. Yeah.
for sure. Now, you have been inside this problem for over a decade, and there is a growing evidence that, insurance are now using automated AI systems to generate batch denials with little or no human review. And that was from AJMC. So, what does the arms race between insurance company AI and provider side AI look like from where you're sitting right now?
Is a really loaded question. So, and probably by the time this podcast comes out, it'll have changed. And if you're listening to this a year from when this podcast came out, it will have changed again.
Wow.
This year, there has been several states that have enacted laws saying that insurers cannot use AI to deny a claim. This is after some of the insurers were using AI and patients were dying, because essentially stuff was getting denied by the AI that shouldn't have been denied, and then patients were dying, and so then there were some lawsuits. So a lot of states have created laws saying that payers cannot use AI to deny a claim. Now, I can use AI to fight the denied claim,
Hmm.
but the payers themselves are being restricted on being able to use AI. Now, what people don't realize about AI is that we've had AI since 1956, and we don't even realize that AI is built into everything. For example, when you open your Outlook and you search for someone's name to find their email, that's AI, okay? It's a type of language processing that's being used, natural language processing. There's like 5 different levels of AI, and this is actually one of the talks that I give at hospital conferences, is where I talk about the different types of AI and how to pick the right AI partner for your hospital or clinic.
Yeah.
This is independent of Authsnap. This is just to educate and help us to adopt technology better in healthcare. Which is one of
Hmm.
my missions in life. But, that problem of the AI arms race is very real, and we're fighting it. And the White House is helping a little bit and also hurting a little bit, because the White House is really wanting to fight the entire global AI arms race militarily. So we want to beat China out. We want to make sure our military is stronger than the rest of the world's AI. So the White House does not like policy restrictions on AI. So this year they've issued some executive orders that are basically saying states cannot put rules around AI for people developing AI because it restricts our ability to be dominant as a global power.
Hmm.
But when you talk about healthcare, we have different situation going on within our own house, right? This is like a US problem because of healthcare being like a unique situation in the US as to the rest of the world.
Yeah.
So there's sort of like a global arms race happening, and then there's like a healthcare arms race. And sometimes I think they clash a little, because
Yeah.
what's best for us globally is not what's best for us in healthcare. So I think it's, to be determined how it's all going to wash out. But some of the
Right.
positive things that I'm seeing come out of this arms race are actually some unity around dropping prior authorizations for things that are always going to be approved. Like,
Yeah.
we've dropped prior authorization requirements on some hip surgeries and different things that, like, 98% of the time we submit a prior auth, it's approved. So why do we have a
Yeah.
prior auth? That's dumb. We can
Exactly.
get rid of that. And there's been some really big champions in both from the payer side and from the hospital side that have been advocating for that push. But I will tell you, even if you get rid of prior auth, you still have the problem of denials because of the boxes that I mentioned. When these physicians are making these choices, they still are going to have boxes that don't get checked. And so
Right.
denials are always going to be there, even if we fix some of the arms race with prior auth. And
Yeah.
quite frankly, that's why we chose denials for our business case, because we saw the writing on the wall with some of this prior auth stuff.
Yeah.
And so we were like, no, we're going to go this direction as a company.
I love that. Now, do you believe that the regularity of the environment is catching up to what is happening?
No, I think it's still way far behind. And the reason is because health systems are naturally slow adopters. Usually for something to get approved in a health system, it takes about 24 months for a hospital to make a decision.
Wow.
The procurement on a hospital for bigger hospitals can be very, very long. For example, if they decide they want to take on a new solution, the first thing is it goes to like the CEO, then it goes to the CFO, then the chief medical officer has to sign off on it. Then usually the chief technology officer or chief information officer. Now we have AI committees, which is a good thing, by the way, who have to sign off on it. And then we have all of the departments and the workflows that have to be changed in order for that technology to be adopted, down to how do the nurses use the technology, how the doctors use it.
Yeah.
So adoption curve in healthcare is extremely slow. And that's why I teach across the country about AI adoption and choosing the right AI partner, because one of my missions is to help us in healthcare adopt faster, whether it's my
Yes.
technology or somebody else's or anything, a
Hmm.
process, right? Anything that we can
Exactly.
help patients to make it go faster is absolutely where we need to go.
Right.
Policy is the same, right? Think
Hmm.
about how we pass laws. I mean, some of these laws we're like putting in place. I'm like, AI is going to be 10 times further by the time this law gets passed.
Yeah.
So the speed that we're going with technology right
Yeah.
now is far faster than any group can keep up with. And, that's
Exactly.
exactly why we built our technology the way it is, because we knew it needed to be nimble across these policy changes.
Yeah. Oh, for sure. Now, where does this go, like in the next 3 to 5 years?
Gosh, well, us specifically as a company, I mean, we are going to be one of the most known pieces of healthcare technology because what we're doing and how we're solving it is so unique and we can
Yeah.
work in any type of place. I mean, you will be able to use this anywhere. It'll be like a computer chip that can be anywhere. And I think as a society, we're going to see two things. We're going to see the healthcare systems that are willing to take a chance on new technology, and they're going to skyrocket. And
Right.
then we're going to see the ones that are in the like, well, we're just going to wait and see. And they're going to get further and further and further behind.
Right.
So, I think the best thing we can do is to educate the healthcare leaders right now that of what's out there, what their options are, and then let them choose. But they have to
Yeah.
know what's all out there so that they can start making decisions faster for the patient population they serve.
For sure. Now, let's give our audience something that they can use today, like for a practice manager or for revenue cycle director listening right now. What is the first thing that they should look at, to understand how much they are losing to denials?
Yeah. So the very first thing they should look at is they should go to their CFO and literally ask, how much are we losing to denials? How much have we actually tracked? If the CFO cannot tell you, you need to call us immediately because this is actually a really common problem. I've been on calls with major health systems and people showed a stack of papers on the camera of the denied letters that they hadn't even gotten to in the last couple of months.
Wow.
Because they were so overburdened and so overwhelmed, they didn't even know. I've been on calls with major health systems that I obviously can't say the name of,
Yeah.
and they don't even know how many denials they have, okay? So this tracking of the problem is one of the steps in the process, and
Oh,
so
yeah.
if a leader is listening right now and you're like, "Oh my gosh, that's us. We don't even know how many denials we have." You need to call us immediately. We have a calendar that you can book a demo and we can just get the bleeding stopped. That's what I always say, like, let's just stop the bleeding right away, get some of this money operationally back in, and then we can start looking at what's happening upstream that might be
Exactly.
causing some of this.
Yeah, for sure. Now, what is the single biggest mistake organizations make and how can they handle denials?
Oh, the single biggest mistake would be that they don't ask for help, that they just keep going with writing it off and saying that that's good enough. I mean, no offense to the CFOs who've been in their positions a while, but they are sometimes the most resistant. So these are people who've been in their position for 30 years.
Yeah,
So they have gotten used to doing things a certain way, and that's not working anymore. And so there needs to be someone brave enough at the organization to raise their hand and say, I don't care that this is how we've been doing it for 30 years. Like, we need to do it differently because healthcare is different than it was 30 years ago.
oh, yeah. Very different. And what is the one thing that changes everything once a practice decides to take this seriously?
Oh gosh, I mean, the revenue right back into their pocket. I mean, it's literally operational revenue immediately back into their budgets. That is a doctor that can be hired. It's a raise that can be given. Better sidewalks they can invest in or a new MRI machine.
Right.
Literally, the possibilities are endless once you start working on this problem.
Oh, I love that. And last question. You left a nurse career because you went through the revenue cycle and you built a company from scratch to solve a problem that most people have never even heard of. What do you want people to understand, not about, AuthSnap, but about the system itself?
I would say I want people to understand that it's not intentionally nefarious, right? It's not trying to rob you. The $54 Tylenol is not because they're trying to just make your life miserable. I think for those of us who are on the consumer side of this problem, the patients, even myself, right? I get denied. I've got several denied claims this year that I had to deal with my own self.
Yeah.
I think it's just being patient that
Yeah.
this is a systemic problem. So
Hmm.
when you call the hospital or clinic, you call your doctor's office, just be kind, right? That person answering the phone, they didn't cause this problem. They're stuck in the same broken system that you are. And I think if we can all approach this with more kindness and compassion, we're all going to be a lot more open minded about how to solve it.
Yeah, for sure. And what would you change if more people knew what you know?
Oh, man. Yeah, I mean, honestly, if more people had this type of knowledge, I think we would be better consumers of healthcare. We would be better at calling our insurance company and making sure that something is actually covered before we book an appointment.
Yeah.
I think we would just be more knowledgeable, which I think would help our personal home finances a lot and our own health. Like we would just be
Yeah.
more educated healthcare consumers.
Yes, I agree with you 100%. Now, for anyone that hasn't heard about you, can you tell people about the services that you provide and where they actually can find you?
Yeah, so you can go to authsnap.ai and I'll get you a link in the show notes that you can that you can click on. But there's a button right on our homepage. Even if you just Google AuthSnap, like authorization and a snap, so AUTH, snap, okay? Sometimes it's hard to hear what's happening in the middle of that word. But it's authorization and a snap. And if you go to AuthSnap, even if you Google us, we chose a name on purpose that was unique so that people would be easy to find us. You'll see our website. It pops right up at the top of Google. And right on our homepage is book a demo. And you can schedule a time that works. It's convenient for you. You'll probably be on a call with myself or someone from the team, and we'll just be sharing with you how we can help you. And we're so happy to help. Now, I will say we don't help consumers directly. So if you are a patient, you need to get your doctor's office to book a call with us because we don't work directly with the consumer. We work with your doctor because that's the way we can be most successful.
I love that. I love that. And for the listeners out there, insurance denials are not just billing errors. They are time, they are burnout, they are patients who waited longer than they should have, they are hospitals that could not stay open. And today, Gretchen you reminded us that, the people who understand a broken system are the best, are often the ones who have positioned it to fix it. And, I thank you so much for being on the show and for all the work that you do. I really admire that, you went through the system, you saw the cracks in the system and you did something about it. You saw that it wasn't working. It wasn't working for you personally, it wasn't working for the people around you. And instead of just giving up and walking away, you took the problem and you found a solution. And I really admire, everything that you're doing because the healthcare system has a lot of cracks and denials is one of them. And I'm so glad there are people like you who are finding solutions and making people's lives a lot easier, especially doctors and hospitals and so forth.
Thank you, Stacey. And thanks for having this show to be able to give a voice so that people can hear more of this type of stuff. So it really means a lot to me.
Thank you. And you have a wonderful day.